Okay, so today I will be reviewing and demonstrating one of the most foundational and simple bandaging techniques, which is the circular bandage. So my name is Francine, I have Zeus with me here as my partner. So circular bandaging involves overlapping concentric turns to provide compression or security over a small, straight segment of the limb. So this is sometimes called an anchoring wrap. So it is typically not used to wrap an entire limb because wrapping layer over layer creates uneven pressure, which can impair circulation or shift easily when the limb moves. So instead, we use circular wraps for two main purposes. The first one is for anchoring. So to anchor the beginning and end of a longer, more complex bandage like a spiral or a figure 8 wrap, so the entire dressing stays firmly in place. And the second function is for coverage, and it's used to secure a specific dressing or a pad, often around an extremity, finger, or head. So since the limb area must be nearly cylindrical or straight for this to be effective, we typically use it only around the wrist, the top of the thigh, or the proximal aspect of an arm. So before we begin any compression and bandaging, patient safety and comfort are the key. So therefore, we always perform pre and post-procedure neurovascular assessments. So I just need to confirm your limb's circulatory and neurological status, okay?
Sure thing.
Okay, so pre-assessment involves observing the color and the temperature of the skin distal to the proposed wrap area and checking the pulse and assessing the capillary refill. So most importantly, I check sensation by asking, do you feel any numbness or tingling in your toes or your fingers, or are you freely able to move them?
They're all fine, yes.
Okay, thank you. So if the pre-assessment is normal, we can proceed. So after the bandage is applied, the post-assessment is absolutely important too. So I will recheck for all of those factors to confirm the bandaging hasn't been applied too tightly or restrict the circulation or the nerve function. Okay, so I'll be starting now. So I'm choosing the wrist area here to demonstrate a tight anchoring technique. So I will always ensure that the roll faces up or toward the direction of my wrap. So to begin, I anchor the initial corner of the bandage diagonally. So like the tip here needs to point up, and then I will make a circular motion. So the bandages that we're using is just kind of loose, so I'm just to make a strong bandage here, I'm just gonna tighten that up a bit. So I'm gonna make one circular motion, and then for the next one I will be folding the flap, and then I'm going to make another circular motion, and then I'm just gonna repeat that for certain more times. Do you feel any pain, numbness? No?
No.
So usually it will just need like 2 or 3, but just for the sake of this video, I'm just gonna use all the bandage that I have here. Okay, so once complete, I secure the end of the wrap directly on top of the final circle with provided fasteners, or in this case, medical tape. Just gonna do it like that. Okay, so now that my circular anchoring bandage is applied, I will conduct the post-assessment. So do you feel any numbness or pain?
No.
Okay, so the color looks good, the pulses feel strong. Capillary refill, it can be checked by pressing the finger right there, and then if the color appears or the finger refills in less than 3 seconds, and the patient reports no numbness or pain. So we just need to remember that circular bandaging is primarily an anchoring technique. So the advantages of using this is it holds an area well, and one of the drawbacks is that if used along an entire limb, the non-overlapping compression gradient will fail to help with overall venous return, and it can restrict movement. So that's all for today. Thank you very much.